The Ibn Sina Foundation is a non-profit community organization, established in 2001, with the vision of bridging the gap between the healthcare needs of an underserved population and the ability of existing public institutions to meet those needs. The foundation operates 5 medical clinics, 4 dental clinics, and 1 children's clinic in Greater Houston and Port Arthur areas. The Ibn Sina Community Clinics provide comprehensive clinical services without any discrimination and treat all patients with respect and dignity. The services are focused on providing low-cost preventive and primary medical, dental, diagnostic, specialty, and children's health services.
We charge only $49 for your blood screening, but if you go anywhere else, it's going to cost you at least $200 for the health screening or the blood work that we do. So we are really having almost 25% of the market rate. In the same way, we probably say that our dental services are pretty much half the cost of the market rate or when below. And we also see patients who can't afford it, and we still provide them service. So in our clinic, we do not refuse anyone who cannot afford. We try to take care of them, and for that we always reach out to the community, and community has always been supporting.
Patients walk in for all regular preventive and primary care services. Medical services include regular consultation, annual examinations, blood tests, vaccination, immigration physicals, school physicals, sports physicals, minor procedures, and many other services. In addition, diagnostic services, such as blood tests, X-rays, ultrasounds, EKG, and echocardiogram facilities are available.
Pediatrics patient versus a geriatrics patient, so from early childhood to middle age and older adults. We have all the subspecialties, we have all the components. So we have a pediatrics clinic and a children's clinic. We do have an adult clinic, adolescent clinic. We do see patients who are in the geriatrics field. If we need to send you to a subspecialist, we have that capacity here as well. So you do not have to travel around. Okay. Hopefully, inshallah, in the future, we're planning to expand this to an ambulatory clinic where you can have surgeries.
Ibn Sina Foundation also provide different specialty clinics throughout the week, and patients are seen by appointments. Anyone can make appointments by calling the clinics. The specialty clinics include cardiology, dermatology, endocrinology, gynecology, nephrology, orthopedic, pediatric cardiology, podiatry, rheumatology, and urology. More specialty clinics are added every year. The dental clinic offers a wide range of dental services. These services include, but are not limited to, dental exams, X-rays, 3D scans, dental cleaning, fillings, extractions, root canals, crowns, bridges, dentures, and implants. Additionally, a child-friendly children's clinic offers medical consultations, immunizations, hearing screening, vision screening, school physicals, and blood tests at a very affordable price to children of all ages.
Because we provide good health, and it's not subpar healthcare. Okay, and so that's the recipe for success. The other part of this is having good people working for you, a good team. So your team is very strong in the back, your physician and nursing team is very strong in the front, and the physicians and the nurses are taking care of the patients the way they are supposed to be treated, and that's pretty much it.
Mental and behavioral health services are an integrated part of service delivery. Mental wellness services include screenings, counseling, psychiatric consultation, stress management, and hypnotherapy. Our counselors, social workers, and psychiatrists are available at the clinics to provide mental and behavioral health services with complete confidentiality.
I think in many communities and many communities of color, people from racial and ethnic minorities, people who maybe don't speak English as their first language, we see that they're more likely not to necessarily want to talk about what's happening. We're doing a lot of community outreach and are continuing to build our community outreach to do more partnerships with schools and with actually other faith-based organizations. So we know that most people have a faith, a religion, they're spiritual people, and many times they actually go to their leader, their faith leader, to think about something that they're struggling with. We also then want the faith leaders to understand what is it that they can help this person with, but when do they also need more expertise in mental health.
At Ibn Sina clinics, telehealth is easily available from community clinics, as this is an important resource for the community to get non-urgent medical services from the comfort of their homes. Foundation accepts all major medical insurances, Medicaid and Medicare, for medical care, children care, and dental services. The friendly staff and team of specialists at Ibn Sina speak multiple languages and are efficient in addressing the healthcare needs of the patients who visit the clinics.
We have a community that are able to support Ibn Sina to sustain, because our losses are pretty much about $1 million every year. So to really sustain and have a continuous growth in Ibn Sina, definitely we're going to need support from the community. We will need support from the city, state, county, and federal government. So we are getting at this time some support, but is not enough. We need to really scale up our services. We would need a lot of support from at the state level, so we can provide more locations in city and create more access.
The Ibn Sina Foundation has completed many projects and programs successfully, with public and private partnerships. These programs are sustainable and affordable. The Foundation's notable achievements include strong support and frequent visits by elected officials, healthcare leaders, and several other dignitaries to Ibn Sina clinics.
The executive management work day and night, and they work round the clock, 24/7, they're available. So thank you management and their leadership. Liaquat Khwaja has been our CEO, and he has been doing a fantastic work and continuously with us, and hoping that we will continue our journey together.
The Foundation's active participation in rehabilitation efforts during flood calamity and COVID-19 outbreak highlight Ibn Sina's achievements in Houston's healthcare system and overall community service. Ibn Sina is one of the largest healthcare providers of its kind in Greater Houston, serving several thousands of patients every year. Since its inception, Foundation has provided over 1.1 million patient visits. Ibn Sina wishes to thank all the community leaders, partner organizations, donor foundations, public health institutions, academic institutions, and elected officials for their continued support in serving the community.